all to this year's TCT India South Asia 2020 conference. I request Dr. Antonio Colombo to declare this conference open.
Thank you very much first for having me with you, and congratulations to all the faculty and to you, Dr. Kumar, for making this meeting happen.
So, it's always also a pleasure to speak after Dr. Antonio Colombo.
Extremely happy to be at TCT India, as part of my heart is in India.
Brief introduction of the team. Dr. Urmil Shah is my partner for 20 years. He's an interventional cardiologist. She's an elderly lady. So it's a critical proximal LAD, long lesion, calcified.
A 53-year-old male, no major risk factors, very active, and this was the angiogram.
Thank you all for your patient hearing and participating.
Cost constraints, and even actually in the United States, it is only available as part of research.
One thing, and that's very important to understand, doing other lesions at the same sitting, I think all of us will learn something from each of these experiences.
I had this patient whose renal function was not adequate. His creatinine was 2.9.
I think there were fantastic talks.
We really wanted to test the hypothesis of whether cardiac death and MI was reduced.
Thanks for an excellent talk.
There's clearly a lot of disease. There's clearly a beautiful description of a ruptured plaque.
She was a little unstable until we opened the LAD.
PCI at the major challenge.
Then I withdrew the value to stay the state.
We want to make sure they're optimized before the case. In general, I do a right heart cath, measure filling pressures in patients with valve disease.
Specific area and achieved just a stent area,
where we can produce better results.
A spectrum of cases which will cover.
A 10-year-old surgery with effort symptoms.
Discuss about multi-vessel PCI. Nowadays, after good quality stents coming, we keep doing many of these cases which were earlier being sent for surgery.
I'll be presenting a case of intervention in post-APG patient.
I'm Dr. John, and today I will be presenting a case of ostial left circumflex stenting.
I'll be presenting a case of angioplasty which was done in a patient with extracardiac inversus.
We are going to be discussing complications is the mechanism of angioplasty, which is actually a dissection.
The left vein coronary artery dissection and how do we manage in our lab.
In the cath lab, all of us have seen things which are looking very stable like this.
It's a classical case of 70 years old gentleman who presents with hypertension, obesity.
People who get guideline directed medical therapy at discharge.
Over 1 lakh invasive angiograms and almost 13,000 CT coronary angiograms.
I thank all the speakers and my co-chairs and panelists for this excellent seminar. Although it was delayed, I think we got the message from all of them. Thank you very much.
A highly effective PCI should begin with the end in mind.
FFR incorporates stenosis severity, myocardial territory and viability.
Why FFR is important, that the interventional cardiology had gone into a little disrepute.
Patient had it well this year.
We wanted to understand two things. One is actually how significant is ostial circumflex and how significant is the mid-LAD lesion.
Redilatation of a tissue valve, there are two reasons. One is you can tear the leaflet.
I've made this timeline of innovations which are pertinent to pediatric catheter intervention.
Today I am going to give some kind of information on the coronary MF device from innovation to clinical practice.
This is the kind of historical timeline. The first aortic valve implantation, which was indeed done by surgery, was actually in the descending aorta.
Now this is acquired aortic interruption, so that means it's not in the real sense, the congenital aortic arch interruption what we come across in neonates and infants.
There were bounding pulses and 3/6 ejections systolic normal, and we can see at the X-ray that there is a cardiomegaly.
You are a 16-year-old boy who was born with complex functional single ventricle disease.
Hospitality, the quality of the educational experience, the engagement of the audience has always been terrific. I wish I could be there with you. Unfortunately, circumstances are otherwise.
And your experience over the last 15 plus years?
Thank you, Sushil, and thank you, TCT India. I know
our mentor and supporter, Mario Leon, for many years. He's still working hard on bringing us the up-to-date information.
And we are extremely thankful to you.